Perfect. Exhale. Perfect. Other side. Good. A little bit rotating right here. Okay guys, got Chris in the office. Came in about, let's see here exactly, last month with some pretty severe low back pain. He had been a patient previously. Missed a little bit of time over the summer and then came back with some low back pain. He's really doing much better, correct?
That is correct.
All right, he's doing great. So able to do things, go to, he was just at, I think Cedar Point. Yeah, and so he's able to walk and do all that kind of stuff and not have a lot of back pain, whereas before he was having a ton. So we're just going to show you our low back treatment and our full spine adjustment on Christopher. So again, first check his leg length. He's a little bit out there. So when you have a little bit of leg length difference, he's a little short on his right. It's very simple. It's his right ilium has rotated an extension in relation to his sacrum, so he has an extension restriction here. So and that's what we do a lot of the drop table work. So the drop table, although it sounds really loud, is actually very comfortable. You see Chris, he can lay very neutral. We're not twisting, although we will, but if somebody can't tolerate the twisting, if you're watching this and you have a very bad herniated disc, let's say, I wouldn't be twisting you, which you'll see in a second. I would just be doing the soft tissue and the drop work, and you still get great results. So, and he's been coming in now, 8 or 10 adjustments, visits so far, so he responds pretty well. So just those few drops helps take out some of the unleveling in his pelvis and his low back. So now we're gonna do some soft tissue work, and we kind of get on this QL, this quadratus lumborum muscle that attaches all the way up the lumbar spine, then down into his right ilium. And we're just trying to strip out the adhesions and the knots that build up there that can be implicated in low back pain. So in our office, you're not just getting adjusted and sent out the door. We're trying to do some extra soft tissue work on each patient that comes in. And I can feel he's even a little bit rotated right here. One more. Perfect. Deep breath in for me, Christopher. Exhale. Good. Just clear out his mid back. Go on your side facing me. Very good. And this arm up. Take a nice deep breath. Exhale. Perfect. Other side. This one on top. Deep breath again. Exhale. That's it. Face up. So his low back moved great, and that's basically all we're going to do for his low back. Maybe a little bit of stretching, but we're going to adjust his neck too. You still working from home?
Yes, I
You're
am.
at home. So again, working from home. So many of our patients do that now. We're on a computer screen most of the day. You're on Zoom calls, or you're doing paperwork, and you get this rounded, shoulders rounded, your head's down, you're in a flexed posture, and it's very bad for your cervical spine. You may not have a lot of neck pain or headaches at the time, if you're watching this now or whatever the case may be, but over time, that postural stress is going to lead to a lot of arthritis basically in your neck and scar tissue buildup. It's better to get ahead of it and be preventative and get adjusted and prevent that wear and tear buildup. Don't just wait for a lot of pain to build up, because it takes a long time. It may take years to develop severe chronic pain and by that time it's almost too late to do anything. Just relax your shoulders. Good, same thing here. Perfect. Breath, one more in his mid back. Exhale. Good. Perfect. We're going to do a little stretch on both sides. Now we'll do this with some patients. Again, he's specifically having some low back pain, so we're just going to take his hip into flexion, and then we're going to bring it over across and get like the piriformis, the glute. These are great stretches also to do at home. Kind of bring it into a figure 4. Hang on, just where your arms are, Chris. Just relax your leg, a little pull, and this one here. So again, these are to do it at home on a hard surface. These can hold this for a minute, 2 minutes, bring your knee to your chest, then bring your knee over towards the opposite shoulder. And then again, bring it into the figure 4. Use a stretch band or a towel at home. These are great stretches for the low back. Perfect. Thank you, that's it.